And there are hundreds of hospital beds sitting open near Milwaukee right now, but South Central Wisconsin doctors are having a hard time sending patients there to free up space where it is needed.
Well, Naomi Coles found after 6 weeks the alternate care facility is still a work in progress. Naomi?
Eric, the day before Governor Evers said he was opening the field hospital back in October, 853 people were hospitalized for COVID-19 in Wisconsin. That was October 6th. Today, that number has nearly tripled to almost 2,300. But the 500-plus bed facility is still mostly empty. Built in April and opened in October because of the surge in COVID-19 hospitalization.
Take some of the pressure off the system.
The alternative care facility at the Wisconsin State Fairgrounds had 23 patients on Tuesday. Very few of them come from South Central Wisconsin.
That field hospital has several limitations on who can go there.
Doctors identify a few big hurdles to using the facility so far. First, many patients don't want to go.
I think folks are uncertain what an alternative care facility is. It's far away. You still can't have visitors. So when we say, hey, we're busting at the seams. We've got patients who've got, much more severe disease than you do. You would do great at the ACF. Are you okay if we transfer you there? They say no.
Secondly, it's only equipped for a low level of care, and admittance guidelines are strict.
You actually have to be fairly healthy to go to the field hospital. You cannot be severely ill. You cannot be requiring ICU level care.
That's the catch, because right now ICUs are filled with COVID patients. UW Health has expanded to 6 COVID units, most added in the last month. Unity Point Health Meriter is treating more than 60 COVID patients, with more than a quarter of them in intensive care, an all-time high. Everywhere, hospitals are running out of beds and staff.
A lot of hospitals are reaching capacity. Is that combination of not only the COVID patients, but also the non-COVID patients that we're still trying to provide care for.
Several healthcare systems tell me they're constantly evaluating patients to transfer to the field hospital. But between Unity Point Health Meriter, UW Health, and St. Mary's in Madison, just 4 patients so far have made the trip.
Obviously, once a patient gets admitted to the hospital, it's very difficult to ask them to leave once they're settled with their care team.
The Department of Health Services didn't respond to questions asking for details about funding and more today. We do know it's coming out of the governor's $445 million surge reserve fund for COVID-19. And the doctors I talked to said the DHS is working to update some of those restrictions and ways to work better for hospitals.